Welcome to Mastering and Guideline in Ultrasound and Echo.
Hi everyone. In this lecture, I'm going to talk about tricuspid regurgitation, and later we go another lecture for tricuspid stenosis. Let's look at the anatomy of the tricuspid in little detail and in practical way. As its name come up, this tricuspid valve or right atrioventricular valve has three leaflets, but in one study it showed that three leaflets only has been seen in 25%, and half of them had actually four leaflets. So four leaflets is more common than three leaflets. Second, for each leaflet there is one papillary muscle, but for it can be variant like the number of the leaflets from the 2 to 9 papillary muscles. The surface area of the tricuspid valve orifice is the same as the mitral valve, is almost 4 to 6 centimeter square. The having good imagination of tricuspid valve related to the location and other chambers and other valve is very important and critical when we are going to, especially in echo, evaluate and maneuver and get good image and understanding what is going on with the valve. Here you can see, if we take the anterior part of the heart, you can see infundibulum of the right ventricle, pulmonary, tricuspid, and relationship with the tricuspid disc and the other three valve you can see on here from the side. Here coronary sinus drop and empty drain right superior to the septal leaflets, and you can see the relationship with those other valve and how the orientation. Having good image is very important. I recommend pause it and get this one. If you have knowledge, go over it and see how the orientation is on the those valve and those chambers. Is very important when you scan, and have keep in your mind the correct orientation of the heart in the body. And when we scan it, in that case it's easy to do any maneuver you want to find any structure. Tricuspid valve has three leaflets, as I said, classic shape. We have anterior, septal, and posterior. Right coronary sinus, you can see drain to the above to the septal leaflet. And as you can see here, the ring of the tricuspid and the ring of the mitral valve, they are not at the same plane. They are at this different level of the plane, almost 90 degree perpendicular to each other. And that is the reason we never can see on the PSAX both of those valves at the same level. Besides of that, the insertion of the tricuspid to the compared to the insertion of the mitral valve to the septum is a little different, more apical, that I am going shortly talk about that. Related to the tricuspid valve, we have to keep two important uh, parameter in our mind. First of all, the insertion of the tricuspid related to the mitral valve insertion to the septum. Usually in normal situation, the insertion of tricuspid to the septum is more anterior, apical, toward the apical, as you can see here. Here is insertion of anterior mitral valve leaflet at this level, and insertion of the septal to the septal leaflet of tricuspid to the septum is this level. The differences is normal situation is less than 0.8 centimeter per square of the body surface area. If it goes more than that, it goes to category of the Epstein anomaly, that I will talk about it in detail in pediatric echocardiography in another lecture. Another one is relationship between the ring of the mitral valve. Here, mitral valve, we are watching from posterior view, and this is a mitral valve ring, and this is tricuspid valve ring. You can see they are not at the same level. They are almost perpendicular and 90-degree in different plane and axis. So that is the reason we never get it all those two valve, especially ring, at the same plane. We have to do approach different way for getting each of them. That I'm going to talk about that shortly in echocardiography diagnostic of the tricuspid valve. Tricuspid valve should be evaluated at least in 3 different views. But we can evaluate this valve in other view too, more than 3 views. In those, important are, one of them is on the plaques, that we call it RVIT, or right ventricular inflow tract, PSAX or short axis parasternal, apical, subcostal, and those other off-axis view too. Now let's go first with the plaques RVIT view. For RVIT view, as you know, on the plaques, our probe marker to between 10 and 11 o'clock and perpendicular to the chest at the right parasternal, left parasternal. Then we fan it our tip of the probe toward the right hip of the patient or our left side. Just fanning without twisting. Our sector pass through this region. You can see posterior view on this view, how the sector passed through posterior here, a little cut the inferior vena cava. Then this is our cross section, hard cross section RVIT, as you can see here. Then machine rotated, or ultrasound machine rotated and show on monitor this view, that it looks like the right atrium is inferior to the right ventricle. That is not right anatomically, because right atrium is superior compared to the right ventricle that is inferior, because only image has been rotated. Here finally give us this impression of the RVIT that include right ventricle here, and then right atrium at the bottom. Depending on our probe orientation and angling and location, the type of the leaflet, which of those 3 leaflets can be seen, will be different. Let's go and see how.